Rafael Mendoza discovered early in his medical career that legitimate medicine in Mexico City was reserved for those with connections, money, and the right last name. He had none of these. At 32 years old, he held a medical degree from a provincial university that the capital's elite hospitals regarded with barely concealed contempt. After 3 years of rejections from every reputable institution, he found himself practicing medicine in the shadows, in places where questions were never asked and official documentation was never required. His clinic occupied the back rooms of a commercial building in Tepito, one of Mexico City's most notorious neighborhoods. The entrance was through a fabric store owned by a man who asked no questions, as long as Rafael paid his monthly rent on time. The waiting room was small, furnished with plastic chairs and outdated magazines. The examination room contained equipment Rafael had purchased second-hand from bankrupt clinics. Everything was clean, functional, and completely illegal. Rafael specialized in procedures that people could not obtain through official channels. Undocumented immigrants who needed medical care but feared deportation. Young women seeking abortions in a country where the procedure remained criminalized in many states. Drug dealers requiring treatment for gunshot wounds without police reports. Workers who had been injured on job sites where safety regulations were ignored. He charged whatever people could afford, sometimes accepting payment in goods or services when cash was unavailable. He understood the risks. Operating without a license meant potential prison time. Treating criminals meant possible involvement in cartel violence. But after years of poverty and rejection, Rafael had convinced himself that he was providing a necessary service to those society had abandoned. He told himself he was a doctor first, regardless of where he practiced or who his patients were. Mariana had married Rafael 5 years earlier, when he still believed he would eventually be accepted into the legitimate medical establishment. She was 23 then, a pharmacy assistant who had met him when he came to purchase supplies. She fell in love with his idealism, his genuine desire to help people, his gentle hands and earnest eyes. They married in a small ceremony attended by both families, who harbored hopes that Rafael would soon secure a position at a proper hospital and provide their daughter with a comfortable middle-class life. Those hopes gradually died as the years passed and the rejection letters accumulated. When Rafael finally opened his underground clinic, Mariana supported the decision, despite her private fears. She quit her pharmacy job to work alongside him, managing appointments, sterilizing equipment, and assisting during procedures. They lived in a modest apartment 15 minutes from the clinic, furnishing it gradually as their savings allowed. Their life together was built on shared purpose and mutual dependency, even if that purpose existed outside the law. The work was exhausting and sometimes traumatic. Mariana witnessed suffering that no amount of professional distance could make bearable. Patients arrived desperate, often in severe pain, sometimes dying. She learned to control her emotions, to maintain the calm efficiency that medical work required. But at night, lying beside Rafael in their small bedroom, the images returned. The pregnant teenager hemorrhaging after a botched abortion attempt elsewhere. The construction worker whose arm had been crushed by falling scaffolding. The knife wound victim who arrived already in shock from blood loss. Rafael noticed her distress but felt powerless to relieve it. He would hold her, whisper reassurances, promise that their situation was temporary, that eventually something would change for the better. Neither of them fully believed this anymore, but the fiction provided comfort. They developed routines to manage the stress. Sunday mornings at the market, buying fresh vegetables and flowers. Occasional evenings watching old movies on their laptop. Weekly phone calls to their families, during which they maintained the pretense that everything was fine. The underground medical world operated according to its own codes and hierarchies. Rafael belonged to a loose network of unlicensed practitioners who sometimes referred patients to each other when specialized skills were required. There was Manuel, who handled dental work, Teresa, who focused on gynecology and obstetrics, Jorge, who dealt primarily with trauma cases. They communicated through encrypted messaging apps, met occasionally at neutral locations to exchange information and supplies, and maintained strict boundaries to protect each other if anyone was arrested. Through this network, Rafael encountered people from every stratum of Mexico City's vast underworld. Street-level criminals, corrupt police officers, human traffickers, drug dealers at various levels of the distribution chain. He treated them all with the same professional detachment, asking no questions beyond what was medically relevant. He understood that curiosity could be fatal in his world. See the patient, treat the condition, accept payment, maintain silence. These were the rules that kept underground doctors alive. The cartel presence was impossible to ignore. Mexico City existed under the shadow of competing criminal organizations, their influence extending into every neighborhood, every business, every institution. Protection payments, territorial disputes, sudden disappearances. Rafael paid his monthly quota to local enforcers who ensured the clinic remained unmolested. It was simply another operating cost, like rent and medical supplies. He told himself this money was different from actively working for the cartels, though he knew the distinction was philosophical rather than practical. Mariana understood they were trapped. Walking away meant abandoning not just their livelihood, but their entire identity. Rafael had invested too much of himself in the clinic to simply close the doors. The patients depended on him. The monthly payments to various parties created obligations that could not be casually terminated. And despite everything, despite the constant fear and exhaustion, part of her remained proud of what they did. They helped people who had nowhere else to turn. That counted for something, even if it provided no protection against the dangers surrounding them. The pattern of their lives seemed fixed, unchangeable. Wake at dawn, open the clinic, see patients until late evening, return home exhausted, sleep badly, repeat. Weekends brought only slightly reduced hours. Vacations were impossible. Savings remained minimal despite the constant work, consumed by equipment maintenance, supply purchases, and the various payments required to operate. The future stretched ahead as a continuation of the present, grinding and inescapable. Neither Rafael nor Mariana could have anticipated how completely that pattern was about to shatter. Neither could have imagined the chain of events that would begin with a late-night emergency call and end in circumstances so terrible that death would seem the only escape. But such knowledge is mercifully withheld from us. We move through our lives believing tomorrow will resemble today, until the moment when everything changes and the world we knew is irrevocably destroyed. The call came at 2 a.m. on a Thursday in late September. Rafael's phone vibrated against the nightstand, its screen illuminating their dark bedroom. Mariana stirred beside him as he answered, his voice thick with interrupted sleep. The man on the other end spoke Spanish with a heavy Colombian accent, his words clipped and urgent. Medical emergency, serious, money not an issue. An address in Polanco, one of the wealthiest neighborhoods in Mexico City. Rafael dressed quickly while Mariana prepared the medical bag they kept ready for emergency calls. These late-night summons were common enough in their line of work, though they rarely came from Polanco. That neighborhood was home to corporate executives, foreign diplomats, and wealthy families who could afford private hospitals with discreet staff. Someone there, calling an underground doctor, suggested circumstances that made conventional medical care impossible. The drive took 30 minutes through empty streets. The address led them to a modern apartment building with underground parking and 24-hour security. The guard waved them through without questions, clearly expecting their arrival. They rode the elevator to the 14th floor in silence, both running through mental checklists of what equipment they had brought and what emergencies they might face. The apartment door opened before Rafael could knock. A thin man in an expensive suit gestured them inside without speaking. The space was vast and minimally furnished, all white walls and designer furniture that looked uncomfortable and unused. 3 other men stood in the living room, all dressed similarly, all watching Rafael and Mariana with flat, evaluating eyes. This was clearly a safe house, a temporary space maintained for business purposes rather than actual living. The patient lay on a leather couch, his shirt removed to reveal a gunshot wound in his left shoulder. He was conscious, breathing steadily, but blood had soaked through the makeshift bandages someone had applied. He appeared to be in his late 30s, with the lean, hard build of someone who maintained their body as a professional tool. His face was striking, almost handsome, despite the pain lines around his mouth and eyes. Raphael knelt beside the couch and began his examination while Mariana unpacked supplies. The bullet had entered just below the collarbone and exited through the back, missing major arteries but causing significant tissue damage. The wound was several hours old based on the blood coagulation. The patient had been lucky, a few centimeters to the right, and he would have bled out before reaching any help. The man who had opened the door stood close, watching every movement. His name was Antonio, and he served as lieutenant to the man on the couch. As Raphael worked, Antonio explained the situation in sparse sentences. His boss, Diego Cardona, had been ambushed leaving a business meeting. The attackers were dead. Diego had refused to go to a hospital, knowing that gunshot wounds triggered mandatory police reports. He needed treatment that would leave no official record. Raphael cleaned and sutured the wound, while Mariana assisted, handing him instruments and supplies with practiced efficiency. Diego remained silent throughout the procedure, his jaw clenched, refusing pain medication until Raphael insisted that muscle tension would make the work more difficult. Only then did he accept an injection, though he watched Raphael's hands with suspicious intensity, as if expecting betrayal. The work took 90 minutes. When Raphael finished, he provided instructions for wound care and antibiotics, warning that infection was the primary risk. Diego would need to rest, avoid physical strain, and have the stitches removed in 10 days. Antonio listened carefully, asking detailed questions, then handed Raphael an envelope containing 50,000 pesos, more than 5 times his usual fee for such work. Before they left, Diego spoke for the first time, his voice rough from pain and medication. He wanted to know if Raphael was trustworthy, if he understood the importance of discretion, if he recognized the consequences of talking to police or rivals. Raphael assured him that he had treated many patients under similar circumstances and had never violated confidentiality. Diego studied him for a long moment, then nodded slowly. Over the following weeks, Raphael returned 3 times to check on Diego's recovery. Each visit revealed more about the man and his organization. Diego Cardona led a Colombian trafficking operation that moved cocaine through Mexico City en route to American markets. He had established himself in the city 5 years earlier, negotiating arrangements with local cartels that allowed him to operate without triggering the territorial wars that consumed so many competitors. Diego was intelligent, calculating and absolutely ruthless when necessary. He had survived a world where trust was rare and betrayal was common by being more careful, more strategic, and more willing to use violence than those around him. But he also understood that sustainable business required certain civilized elements. He paid his people well, honored his agreements, and avoided unnecessary attention from authorities. This pragmatic approach had made him wealthy and kept him alive. During these visits, Mariana accompanied Raphael, as she always did. She noticed Diego watching her, his dark eyes following her movements as she checked supplies and cleaned instruments. His attention was different from the crude stares she occasionally received from other patients. There was an intensity to it, a focused interest that made her uncomfortable in ways she could not quite articulate. Diego began asking questions. Where was she from? How long had she worked with Raphael? Did she enjoy the work? Mariana answered politely but briefly, maintaining professional distance. Yet something about Diego's presence unsettled her. He possessed a kind of charisma that seemed almost gravitational, pulling attention and energy toward himself. Even injured and confined to the apartment, he dominated every space he occupied. By the 4th visit, Diego's wound had healed well. Raphael removed the stitches and declared the patient recovered, though he recommended continued caution for another few weeks. Antonio paid Rafael another generous sum and asked if the doctor would be available for future needs. Rafael agreed, understanding that refusing would create problems, while accepting would bind him more deeply to Diego's organization. As they prepared to leave, Diego approached Mariana directly for the first time. He thanked her for her assistance, his Spanish formal and courteous despite his accent. Then he asked if she and Rafael would join him for dinner the following week, once he was fully mobile again. A gesture of appreciation, he explained. Nothing formal. Just a meal at a good restaurant. Mariana glanced at Rafael, who hesitated only briefly before accepting. Refusing such an invitation from someone like Diego could be interpreted as disrespect. They agreed on a date and time, then left the apartment with a strange tension hanging between them. In the car, Rafael gripped the steering wheel tightly. Mariana stared out the window at the passing streets. Neither spoke about what they both felt. The sensation that they had crossed some invisible threshold and were now moving towards something they could neither predict nor prevent. The restaurant Diego chose was in the Condesa neighborhood, discreet and expensive, the kind of place where privacy was guaranteed and reservations required weeks of advance notice. Rafael and Mariana arrived exactly on time, both dressed in the best clothes they owned, feeling immediately out of place among the wealthy clientele. Diego waited at a corner table, his shoulder fully healed, wearing a tailored suit that probably cost more than their monthly rent. He greeted them warmly, shaking Rafael's hand and kissing Mariana's cheek in the customary Mexican manner. Antonio sat at a nearby table with two other men, close enough to intervene if needed, but far enough to provide the illusion of privacy. Diego ordered wine without consulting them, an Argentine Malbec that the sommelier brought with reverent care. The conversation began safely enough. Diego asked about their work, their lives, how they had met. Rafael answered most questions, gradually relaxing as the wine flowed, and Diego proved to be a charming host. He told stories about Colombia, about growing up in Medellin during the violent years, about coming to Mexico seeking opportunities that his home country could no longer provide. He made them laugh with observations about Mexican customs that confused foreigners, about his struggles learning the local slang and navigating the city's impossible traffic. But Mariana noticed how often Diego's attention returned to her. He asked about her family, her childhood, her dreams before she started working at the clinic. His questions were personal but not invasive, delivered with genuine seeming interest. She found herself answering more freely than she intended, talking about the pharmacy where she had worked, about wanting to study nursing before financial realities made that impossible, about the gap between the life she had imagined and the life she now lived. Diego listened with focused attention, occasionally asking follow-up questions that demonstrated he was truly hearing her words. It had been years since anyone had listened to Mariana this way. Rafael loved her, but he was exhausted, consumed by the clinic's demands. Their conversations had become functional, focused on immediate problems rather than deeper thoughts or feelings. Diego's attention felt like sunlight after a long darkness. The meal lasted 3 hours. By the end, they had consumed 2 bottles of wine, and Diego had insisted on ordering dessert and coffee. He paid the check without allowing Rafael to even gesture toward his wallet, dismissing his protests with an easy wave. Outside, Diego's driver waited with a black SUV. He offered them a ride home, which they accepted, too wine-relaxed to refuse. In the vehicle, Diego sat beside Mariana, while Rafael took the front passenger seat. The conversation continued, though quieter now, more intimate. Diego spoke about loneliness, about how his work made genuine connections difficult, about missing the family he had left behind in Colombia. Mariana felt his words touching something inside her, a recognition of shared isolation. She too felt alone, despite being married, despite working alongside Rafael every day. When they reached Rafael and Mariana's apartment building, Diego walked them to the entrance. He thanked Rafael again for the excellent medical care, then turned to Mariana. He took her hand gently, holding it perhaps a moment longer than necessary. He told her it had been a genuine pleasure getting to know her, that she was clearly an exceptional person, that he hoped they might all have dinner again soon. That night, lying in bed, Mariana replayed the evening in her mind. She felt guilty for how much she had enjoyed Diego's attention, for the small thrill that had run through her when he held her hand. She told herself it meant nothing, that she was being foolish, that Diego was a dangerous criminal who had shown them courtesy for professional reasons. But sleep came slowly, and her dreams were confusing. Diego called Rafael 3 days later with a medical question about his shoulder. The conversation was brief and professional, but at the end, he asked if Rafael and Mariana might join him for coffee that weekend. He was still learning the city and appreciated having knowledgeable locals to show him interesting places. Rafael agreed without consulting Mariana, seeing only an opportunity to maintain good relations with a valuable client. The coffee meeting led to another dinner, which led to an invitation to a private art gallery showing, which led to a Sunday afternoon at Chapultepec Park. Each meeting seemed innocent enough on its surface. Diego was always gracious, always included Rafael in conversations, always behaved with perfect propriety. But the pattern was unmistakable to anyone watching carefully. Diego was courting them, or more specifically, he was courting Mariana, while maintaining Rafael's willing participation. Mariana understood what was happening, but felt powerless to stop it. Diego's gifts began arriving at the clinic. Flowers for the waiting room, a new autoclave to replace their aging sterilization equipment, an envelope of cash presented as payment for consulting services that were never actually rendered. Each gift came with a card addressed to both of them, maintaining the fiction that this was simple generosity toward friends. Rafael accepted everything gratefully, seeing only Diego's kindness and failing to recognize the deeper strategy. Or perhaps he did recognize it, but chose to ignore the implications, seduced by the money and attention from someone so powerful. Their financial situation had improved dramatically since meeting Diego. The stress that had defined their marriage for years was finally easing. Rafael slept better, smiled more, talked about future possibilities that had seemed impossible before. But Mariana felt the trap closing around them. She noticed how Diego engineered moments alone with her, brief conversations when Rafael was distracted or had stepped away. Nothing inappropriate happened during these moments, but the emotional intimacy was growing. Diego spoke to her about things he never mentioned around Rafael, his fears about his work, his loneliness despite being surrounded by people, his sense that he was living a life he had not chosen but could not escape. These confessions created a dangerous bond. Mariana found herself thinking about Diego at odd moments, wondering what he was doing, whether he thought about her. She felt herself being drawn towards something she knew was destructive, like watching her own hand reach toward a flame while being unable to pull back. The situation terrified her, but some part of her that had been dormant for years was awakening, and that awakening felt more powerful than her fear. 2 months after that first dinner, Diego invited them to his beach house in Tulum for a weekend. Rafael accepted immediately, excited by the prospect of a vacation they could never have afforded themselves. Mariana wanted to refuse, but could not articulate why, without revealing thoughts and feelings she was not ready to acknowledge. So she agreed, and they drove south toward the Caribbean coast, toward 3 days that would permanently alter the trajectory of their lives. The beach house was not a house, but a compound, sprawling across prime oceanfront property with multiple buildings, an infinity pool and private beach access. Staff maintained the grounds and prepared meals, appearing and disappearing like ghosts. Antonio and his security team occupied a separate structure, visible but maintaining distance. Rafael and Mariana were given a guest suite with floor-to-ceiling windows overlooking turquoise water. The first day passed in lazy luxury. They swam in the warm Caribbean, ate fresh ceviche prepared by Diego's chef, drank cold beer under palm shade. Rafael seemed transformed, laughing freely, his perpetual tension finally released. He kept thanking Diego for the invitation, for his generosity, for treating them like true friends rather than employees. Diego accepted the gratitude with casual grace, playing the role of magnanimous host. That evening, after dinner and considerable wine, Rafael complained of a headache. Diego immediately offered medication from his extensive personal pharmacy. Within 30 minutes, Rafael announced he needed to lie down, apologizing for being poor company. Mariana started to follow him to their room, but Diego suggested she stay, enjoy the ocean breeze, have another drink. Rafael waved her off, insisting she not waste the beautiful evening nursing him, so Mariana remained on the terrace with Diego, listening to waves crash against the beach below. They sat in comfortable chairs, the darkness complete except for scattered lanterns and the silver moon path across the water. Diego poured expensive mezcal, and they drank in silence for several minutes before he spoke. He told her he had been fighting his feelings for weeks, but could no longer pretend. He was drawn to her in ways that transcended simple attraction. She represented something he had lost or perhaps never possessed, a kind of authenticity and goodness that his world had stripped away. Being near her made him feel almost human again, almost capable of normal emotions beyond calculation and survival. Mariana's heart hammered against her ribs. She tried to deflect, to mention Rafael, to restore appropriate boundaries, but Diego gently interrupted. He knew she felt something too. He had seen it in her eyes, in the way she responded to his attention. He was not imagining this connection. And Rafael, he suggested carefully, was a good man, but perhaps not the right man. Perhaps she had settled for safety rather than passion, for companionship rather than true understanding. The words struck deep because they contained uncomfortable truth. Mariana had married Rafael partially from love, but also from practical considerations, from family pressure, from limited options as a young woman in her social position. She had convinced herself that passion was overrated, that steady partnership mattered more. But Diego's attention had awakened something she had deliberately suppressed, a hunger for intensity she had pretended not to feel. Diego moved to kneel beside her chair, taking her hands in his. He was not asking her to leave Rafael, he said. He understood the complications, the impossibilities. But could they not have something for themselves, just for a little while, before reality closed in again? Could she not allow herself this one experience of being truly desired, truly seen, truly valued? Mariana knew she should refuse, should stand up and walk away, should wake Rafael and insist they leave immediately. But the mezcal and the moonlight and the weeks of accumulated tension combined into a kind of paralysis. When Diego leaned forward to kiss her, she did not pull back. When he suggested they walk down to the beach, she followed. When they reached the sand and he pulled her close, she surrendered. They spent 2 hours on that beach while Rafael slept in the guest house. Afterward, Mariana felt hollowed out, shocked by her own actions, unable to process what had happened. Diego walked her back, his arm around her waist, whispering reassurances. This changed nothing, he insisted. Rafael need never know. They could be careful, discreet. She should not torture herself with guilt. The remainder of the weekend passed in surreal dissociation. Mariana moved through the hours mechanically, smiling when expected, responding to conversation while internally screaming. Rafael noticed nothing, still relaxed and happy, already planning when they might return. Diego behaved as he always had, charming and attentive to both of them equally, giving no sign that anything had changed. But everything had changed. During the drive back to Mexico City, Mariana stared out the window and understood she had destroyed her marriage. Betrayed the one person who had always stood beside her, crossed a line she could never uncross. The guilt was crushing, physically painful in her chest and stomach. She wanted to confess immediately, to beg Rafael's forgiveness, to somehow undo what she had done. Yet she remained silent, partly from cowardice, partly from knowing that confession would obliterate Raphael's happiness and their life together, partly from a terrible certainty that Diego would not simply disappear if she tried to end things. She had seen enough in the underground medical world to understand how power operated, how men like Diego responded to rejection. She was trapped by her own weakness and his strength. Diego called her personal phone 2 days later, a number he should not have possessed. He needed to see her, he said, alone, just for coffee, just to talk. Mariana refused, her voice shaking. She had made a terrible mistake. It could not happen again. She loved her husband. Diego listened patiently, then asked a simple question. Did she really want him to stop calling? Did she truly want to never see him again? After a long silence, Mariana whispered no. They began meeting twice a week at a hotel in Roma Norte. Diego rented a suite monthly, maintaining it specifically for their encounters. Mariana told Raphael she had taken a part-time position doing inventory for a pharmacy chain, work that required occasional travel across the city. Raphael accepted this explanation without question. Pleased, she had found additional income and purpose beyond the clinic. The affair continued for 3 months. Mariana lived in constant psychological torment, despising herself, unable to stop, feeling her identity fragment into incompatible pieces. She was the faithful wife at home and the mistress at the hotel. She was the woman who loved Raphael and the woman who betrayed him repeatedly. The cognitive dissonance was maddening, yet she could not find the strength to end it. Diego, for his part, became increasingly possessive. He wanted more of her time, more of her attention. He began hinting that she should leave Raphael, that he could provide for her, that they could build a real life together. These suggestions terrified Mariana more than anything else. She did not love Diego. She was addicted to his attention, trapped by her own weakness and his manipulation. But she did not love him. In late January, Mariana's period failed to arrive. She waited a week, then another, denial warring with growing certainty. Finally, she purchased a pregnancy test from a pharmacy far from their neighborhood. The result was immediate and definitive. She sat on the bathroom floor of the hotel suite and wept while Diego held her, his face unreadable. Diego's initial reaction was silence. He sat on the hotel bed, while Mariana remained on the bathroom floor, the positive test still clutched in her shaking hand. When he finally spoke, his voice was measured, carefully controlled. He asked how far along she thought she was. Mariana calculated 8 weeks, maybe 9. She had been so consumed by guilt and fear that she had not noticed the early signs. Diego stood and began pacing, his mind clearly working through scenarios and complications. Finally, he turned to her with an expression that mixed tenderness and calculation. He wanted her to have the child. He had never had children, never allowed himself that vulnerability given his line of work. But now, approaching 40, he found himself wanting something beyond money and power. He wanted legacy, connection, something that would outlast him. Mariana stared at him in disbelief. Have the child? How could she possibly have his child while married to Raphael? The logistics were impossible, even before considering the moral catastrophe. Diego dismissed her objections with the confidence of someone accustomed to solving problems through force of will and money. She would leave Raphael. Diego would set her up in a secure apartment, provide everything she needed. The child would want for nothing. She refused immediately. She could not leave Raphael, could not destroy him that way, and she could not raise a child born from betrayal, could not look at that child every day and see the worst thing she had ever done made flesh. Diego's expression hardened. He was offering her a life most women would dream of, security and wealth, and his protection. Her refusal seemed not just foolish but insulting. The argument escalated. Diego accused her of using him, of treating him as entertainment while maintaining her safe marriage. Mariana shot back that she had never wanted any of this, that he had pursued her relentlessly, that he had manipulated her into the affair. Diego's eyes went cold in a way she had never seen before. He reminded her quietly that she had choices to make. and she should consider them very carefully. Then he left the hotel room, leaving her alone with the positive test and spiraling panic. Mariana understood she had three options, each impossible in different ways. First, she could have the child and tell Raphael it was his. But Raphael knew their intimate schedule precisely. He would calculate conception dates and know something was wrong. And the child might inherit Diego's distinctive features, his darker skin tone, his build. The deception would eventually fail. Second, she could confess everything to Raphael and beg his forgiveness. But Raphael's pride would be shattered beyond repair. His identity was built on being the provider, the protector, the one constant in her life. Learning she had betrayed him with someone wealthier and more powerful would destroy something essential in him. And Raphael had access to surgical equipment, drugs, instruments. In his devastation, she feared what he might do to Diego, to himself, or even to her. Third, she could terminate the pregnancy. Raphael performed abortions regularly at the clinic. She could ask him to do the procedure without explaining why, claiming contraception failure. But Raphael would ask questions, would want to discuss their readiness for parenthood, would sense something was wrong. And some deep part of her, despite everything, recoiled from ending the pregnancy without Raphael knowing the truth. For 2 weeks, Mariana existed in paralyzed indecision. She avoided Diego's calls and messages. She moved through her daily routine at the clinic like an automaton, assisting Raphael while the secret grew inside her. She lost weight, slept poorly, and jumped at sudden noises. Raphael noticed her distress, but attributed it to overwork and stress. He suggested she take a few days off, rest, let him handle the clinic alone. She refused, terrified of being alone with her thoughts. Diego appeared at the clinic on a Wednesday afternoon, walking through the door like any other patient. His presence electrified the space with tension. He told Raphael he was experiencing headaches, possibly related to his old shoulder injury. Could the doctor examine him? Raphael, unsuspecting and eager to help his friend and benefactor, immediately agreed. While Raphael prepared the examination room, Diego caught Mariana alone in the supply closet. He backed her against the shelves, his body blocking escape. He told her time was running out. Decisions needed to be made. If she insisted on ending the pregnancy, he wanted it done properly, in a real facility, not Raphael's underground clinic. He would arrange everything, pay for everything. But she needed to decide now, today. Mariana felt the walls closing in. She whispered that she needed more time, needed to think clearly. Diego's patience was clearly exhausted. He told her she had until Friday to decide. After that, he would make decisions for her. The implied threat hung in the air between them. Then Raphael called from the examination room, wondering what was taking so long, and Diego stepped back, his pleasant mask sliding into place. That evening, Mariana made her decision. She would ask Raphael to perform an abortion, would claim the pregnancy was his, but that she was not ready to be a mother given their unstable life. She would endure his disappointment and questions. She would accept his hurt feelings about her unilateral decision. But she would end this nightmare and try to rebuild some version of her life. She waited until they were home, until after dinner, until they were sitting together on their worn couch. Then she told him she was pregnant. Raphael's face transformed with joy before she could continue. He pulled her into his arms, laughing, already talking about names and how they would manage, about finding a bigger apartment, about how this changed everything for the better. Mariana's carefully prepared speech dissolved. She could not destroy his happiness, could not take this moment from him. So she smiled and nodded and let him believe the child was his, let him dream about their future, while inside she crumbled into dust. Raphael immediately began planning. They would need proper prenatal care, which meant finding a discreet obstetrician who would not ask too many questions about why an underground doctor's wife was not using official medical services. He would reduce her workload at the clinic, protect her from stress and exposure to dangerous chemicals. He became tender and solicitous in ways he had not been in years, his focus entirely on her well-being and the child he believed they had created together. The lies compounded daily. Mariana let Rafael accompany her to appointments with an obstetrician Diego had secretly arranged and paid for. She let Rafael hear the heartbeat and see the ultrasound. She let him place his hand on her growing belly and feel the first movements. Each moment of his joy drove daggers into her heart. She was trapped in a nightmare of her own creation, unable to escape without destroying everything and everyone around her. Diego, meanwhile, had not given up. He called, sent messages, appeared unexpectedly. He told her the child was his, regardless of what Rafael believed, that blood would tell eventually, that she was only delaying the inevitable reckoning. His obsession grew as the pregnancy progressed. He began talking about taking the child after birth, raising it himself, giving it his name and protection. These threats sent Mariana spiraling into panic attacks that she had to hide from Rafael. By the 7th month, Mariana understood there was no good ending to this story. Every possible future led to catastrophe, and she began considering a fourth option, one so terrible she could barely acknowledge the thought. But as the days passed, and the pressure mounted, and the lies became unbearable, that dark option began to seem like the only way out. The plan formed slowly in Mariana's mind over weeks of sleepless nights. She would stage a late-term miscarriage, something traumatic enough to explain the loss of the pregnancy, but not so severe that Rafael would insist on hospital care. She researched complications, studied symptoms, calculated risks. It was insane and dangerous, but every alternative seemed worse. Rafael would grieve, but he would never know the truth. Diego would have no child to claim. The nightmare would end, but Diego discovered her intention before she could act. Antonio had been watching the clinic, monitoring her movements, reporting back. When Mariana purchased medications that could induce premature labor, Diego knew immediately. He appeared at her apartment one afternoon when Rafael was at the clinic, letting himself in with keys he had somehow obtained. His rage was cold and controlled, more terrifying than shouting would have been. She was planning to kill his child. His child. Did she understand what that meant? Did she comprehend what he did to people who betrayed him this completely? Mariana backed against the wall, her hands instinctively protecting her swollen belly. She tried to explain, to make him understand the impossibility of their situation. Diego cut her off. There would be no abortion, no miscarriage, no loss of his child. He would ensure it. The threat was clear. If she tried to end the pregnancy, consequences would follow. Not just for her, but for Rafael. Diego could make problems appear for an unlicensed doctor. Raid's arrests worse. Rafael would lose everything, possibly his freedom, possibly his life. Did she want that on her conscience along with everything else? Mariana collapsed into a chair, defeated. She asked what Diego wanted from her. His answer was simple. She would leave Rafael within the week. She would move into an apartment Diego had already secured. She would have the child under proper medical supervision. Afterward, they would discuss custody arrangements. If she cooperated, Rafael would be left alone to continue his practice. If she refused, Rafael would be destroyed. That night, Mariana told Rafael everything. She could no longer sustain the lies, could no longer watch him prepare for a child that was not his, could no longer bear the weight of her betrayal. She confessed the affair, the pregnancy's true paternity, Diego's threats and demands. She wept and begged forgiveness she knew she did not deserve. Rafael's response was worse than rage. He went completely silent, his face draining of color. He stood and walked to their bedroom, closing the door. Mariana heard nothing from inside, no sounds of anger or grief, just terrible silence. She sat on the couch for hours, waiting, until finally she fell into exhausted sleep. She woke at dawn to find Rafael in the kitchen, calm and composed. He had made coffee and set out breakfast. He told her to eat, to keep her strength up. She needed to take care of herself and the baby. His voice was flat, emotionless, as if he were discussing a routine medical case rather than the destruction of his marriage. Rafael had made his own plan during the night. He would not let Diego take Mariana or the child. He would not let his wife leave with a criminal, and he would not allow himself to continue living with this humiliation. There was only one solution that addressed all the problems simultaneously. He explained his reasoning with clinical detachment. He would perform a cesarean section at the clinic that evening. The baby would be delivered early, but viable at 34 weeks. During the procedure, complications would arise. Hemorrhaging that could not be controlled. Mariana would not survive. The child would go to Diego, who would accept it as his own. And Rafael would ensure that his own death appeared to be grief-driven suicide, following shortly after. Mariana stared at him in horror. He was proposing murder-suicide, calmly discussing it over coffee. She refused absolutely. She would leave. With Diego, would accept any consequences, but she would not allow Rafael to do this. Rafael smiled sadly. She misunderstood. This was not a request for permission. This was simply information about what was going to happen. He had already arranged everything. The clinic was prepared. He had called Diego, told him there were concerns about the pregnancy, that an immediate cesarean was necessary. Diego was coming that evening with Antonio. They would witness the birth of the child. They would witness the tragic complications that no doctor could prevent. Mariana tried to run, to escape the apartment, but Rafael had locked the doors and taken her phone. He was gentle but firm, physically stronger despite her struggles. He gave her a mild sedative, told her to rest, promised it would all be over soon and the pain would stop for everyone. That evening, Rafael drove Mariana to the clinic. She was too drugged to fight effectively, her mind foggy, her body uncooperative. Diego and Antonio waited inside, both tense with anticipation. Diego approached Mariana, his hand reaching for her belly one last time. Rafael watched with dead eyes. Rafael prepared the surgical suite with meticulous care. He explained to Diego that the procedure was necessary, that the baby's position required intervention. Diego, knowing nothing about obstetrics, accepted the doctor's expertise. He wanted only to see his child born safely. The surgery began. Rafael worked with steady hands, making the incision, accessing the uterus, delivering a small but healthy boy. Diego wept when he held his son, overcome with emotion Mariana had never seen him express. Antonio stood guard, watching everything, ensuring no deception. Then Rafael began the second phase. The hemorrhaging he induced was real, catastrophic, irreversible. Mariana, partially conscious, understood what was happening. She tried to speak to stop him, but the drugs prevented coherent words. Rafael worked quickly, his face serene, making it appear he was desperately trying to save her while actually ensuring her death. Diego realized too late what was happening. He shouted for Rafael to stop, to do something, but Rafael calmly explained that sometimes complications arose that no intervention could prevent. Mariana died within minutes, her blood pooling on the surgical table, her eyes finding Rafael's one last time with an expression that held both accusation and terrible relief. Rafael cleaned his instruments methodically while Diego held his newborn son and wept over Mariana's body. Then Rafael excused himself, walked into his small office and locked the door. The single gunshot brought Antonio and Diego running, but it was already over. The police found 3 bodies and 1 living infant. The investigation concluded quickly. Unlicensed doctor performs emergency surgery. Patient dies from complications. Doctor, overcome with grief and guilt, commits suicide. The baby was turned over to Diego Cardona, who registered the birth using falsified documents and claimed the child as his own. Diego named the boy Rafael after the doctor who had delivered him. He raised the child with unusual tenderness for a man of his profession, perhaps trying to atone for the destruction he had caused. The boy grew up never knowing the true story of his birth, the 3 lives that had ended so he could begin his own. The clinic in Tepito was shuttered, the building eventually rented to other businesses. Rafael and Mariana's families received their bodies and buried them in separate cemeteries, the truth of what happened dying with them. In official records, they became statistics. 1 illegal medical practice closed, 2 deaths attributed to surgical complications and suicide, 1 orphaned child placed with a surviving relative. No justice was served because no crime could be proven. The real story remained hidden, known only to Diego and Antonio, carried as a burden neither man would ever fully escape. Some nights, Diego would hold his sleeping son and remember the woman who had died bringing him into the world, the doctor who had destroyed everything rather than accept defeat, and the price 3 people had paid for his obsession and their weakness. The end came not with revelation or redemption, but with silence and graves and a child who would never know the truth of his terrible beginning.